In this chapter, we're going to discuss the immune system, which includes the lymphatic system. Let's start off with the definition. A pathogen. Something is pathogenic is something that will infect you. It can be a bacteria, it can be a virus, fungus, parasite, or even a prion, such as the sneezing and mad cow disease. So there's a big difference between infection and inflammation. If you use the word infection, you are implying the presence of a pathogen. There are several different ways that your body will try to protect you against being infected by a pathogen. You can look at these as being non-specific defenses or specific defenses. You can also use terminology such as innate, which, if you recall from discussions about the reflexes and the neurological system, you remember that if something is innate, that means you were born with it. On the other hand, if you weren't born with it, if it's something that develops after an exposure to an infection, the word used for that would be adaptive. So depending on which textbook you'll be using, when you look at this, your innate system does not really care exactly what type of pathogen it is. Let's say that someone sneezed on your pizza at lunch, and it doesn't really matter if the bacteria that went with it contained strep or staph or whatever. Let's say that the person that made your egg McMuffin this morning had coliform bacteria. Again, all these different types of bacteria, things like the stomach acid, will try to eliminate all of them. So on the specific side, this side is going to be adaptive. This would be saying if your friend sneezed on you with a certain strain of the flu virus and you became infected with it, your immune system will learn to recognize that particular virus so that if a third friend sneezes on you, then perhaps you won't become infected with that virus because your immune system will be able to fight it off. Or if you do become infected, then perhaps you will not be as sick as you were the first time. Just to give you an idea of why your immune system is important, it took about 60 seconds to Google abuses in your fast food industry, and I'm sure you can recognize the uniforms in these pictures. People do stupid things, so you're going to be exposed to a lot of things that you would never have considered when you ordered your taco or pizza or whatever. And most of the time, it's not going to affect you health-wise. Also, everybody thinks your food source is fairly clean, but there is absolutely no way, because the vast majority of your food is going to be agricultural products. And I'll give you an example. For every 2 chocolate bars you eat, you're eating approximately 16 cockroach pieces. And when I tell students that, they're like, well, why can't they use insecticides and pesticides to eliminate cockroaches? And the fact is that those chemicals are going to be more harmful for you than the actual cockroaches. So when you've ever heard someone say that they're having an allergic reaction to a chocolate bar or chocolate candy, typically they're actually being allergic to the cockroach. They are very pathogenic. So you may have heard some of the big outbreaks of disease that have caught the attention of the media in the last half dozen years or so. There are quite a few people that died from a listeria outbreak from cantaloupe. And it was cantaloupe peeling. It was on the outside of the cantaloupe. People would cut it, and the knife would carry it through the cantaloupe. And most, if not all, the people that died from that were geriatric people whose immune systems were not functioning the way they should. So you may have heard about the outbreaks of things like salmonella in things like peanut butter factories. When they're roasting peanut butter and almond butter, when they're roasting the nuts for that, you're talking about massive industrial ovens, and there's no way there's not going to be some rodents ground up in there when they grind up those roasted nuts. So you can easily find the allowances that the FDA makes for example, every gram of peanut butter will have a certain allowable number of rodent hairs and maggot pieces and this sort of thing, cheese, yogurt, all of these are natural products. But again, the vast majority of times it's not going to affect your health. And a lot of this is because your immune system is on the lookout for problems. And because I had trouble picking my favorite pictures, I just thought I'd add a few more here. Now, before we go on to the heart of this chapter and talk about the immune system, I just wanted to talk a little bit more about what's on this slide. Some references will divide these up into first, second, and third lines of defenses, which is a pretty simple way to look at it. Your first line of defenses will be all your external types of defense systems. Even your saliva and your stomach acid, they are actually truly external when you consider the digestive tract is basically a tube, so that what's in it is actually not inside your body. What's actually inside your body would then be the second line of defense, and that's going to include the phagocytes, remember cells that eat, and the complement fixation and natural killer cells we haven't talked about yet, but we'll talk about that later on in this chapter. And then inflammation, we discussed that before. The whole point of inflammation is so your body can try to fight off infections, try to clean up wounds, try to fix infections, viral infections with things like fever, etc. So again, think about things like your first line of defense being, think about nasal hair. That's going to progress as you go down into your respiratory tract. It's going to turn into cilia, and those things will help keep particulate matter and bacteria from getting down to the lower parts of your lungs. They'll try to work everything back up to be expectorated if they do get past. Again, saliva has enzymes that are a little bit bactericidal or bacterial preventive. Stomach acid, again, mucous membranes, and we'll talk about that a little bit further on in this chapter also. So these are all things that will protect you against very generic problems. So the specific problems that we're going to be talking about, this is actually your adaptive immune system. The job of your adaptive immune system is to be able to focus on a particular pathogen and be able to attack it once it has met it a first time. So that's when they use the term adaptive, that's what they're talking about. It's going to be a pathogen that you've met before, and the second time you meet it, you're more prepared to deal with it. To allow these specific defenses to happen, there's certain basic principles that you have to be able to understand. First off, the body has to be able to recognize what is self or belonging to the body and what is foreign. And this leads to a very important definition, and that is antigen. An antigen is a foreign substance that is going to stimulate the immune system to have a reaction. So it might be a pathogen, such as a bacteria, a virus, etc., or it might be pollen, so it might be something that's going to cause you to have an allergic reaction. But antigen, make sure you're familiar with that concept. If you were to undergo a kidney transplant, that kidney is going to be from someone else's body, so it is not self, it's not yours, and so your body will identify that kidney as being antigenic, and your body will actually mount an immune reaction to it. That's why people who have kidney transplants and heart transplants, etc., have to be on anti-rejection drugs for the rest of their lives. In utero, in the development of the immune system learns to ignore the antigens that are on your own body cells. It learns to identify those as belonging to you. It's a very complicated procedure on how this happens, about how the cells that would react to your own body cells, those clones will actually die out. The development of this lack of reaction to self-antigens is referred to as tolerance. Another way to think about tolerance is a pregnant woman contains a fetus, to start out with as an embryo, then later as a fetus, that is going to have a totally different cellular makeup than herself. And so the fetus would be antigenic to the mother. And so there are hormones, and they think perhaps HCG, human chorionic gonadotropin, that actually causes the mother to develop a tolerance to the fetal antigens so that the body doesn't reject it. So when we talk about the adaptive immune system, we're basically talking about the lymphoid or lymphatic system. So this system is going to be composed of lymphocytes, and don't worry about memorizing this number, but it's just a little bit of a fascinating number. You're going to be producing and maintaining over 2 trillion lymphocytes over your lifetime. So you know that lymphocytes are blood cells, but what you may not remember is that the vast majority of lymphocytes don't actually circulate in your bloodstream, but are actually in your tissues, lurking, trying to find some foreign object it needs to react to. These are all part of the lymphatic system. The lymphatic system includes a fluid that's known as lymph. Another term for it is chyle. You'll see that prefix used in words, for example, like chylothorax. So when you see that prefix chyle, that's referring to lymphatic fluid. The lymphatic fluid flows inside vessels known as the lymphatic vessels, or just simply lymphatics. And then we have lymphatic tissues and organs, and I'll give you the difference in that in just a second. And then lymphocytes, we've already mentioned those. And then finally, phagocytes have a job of assisting the lymphocytes. These are actually, remember, part of your nonspecific defenses because they will try to eat anything that comes in their pathway, but they're going to help lymphocytes identify what's really pathogenic. Lymphatic tissue and lymphatic organs are basically simply connective tissue that has a really high population of lymphocytes. The difference between a lymphatic tissue and a lymphatic organ is that the organ has a capsule. It's encapsulated. Things like spleen, lymph nodes, etc. So lymphatic tissue can just be diffusely spread out. And one example of that would be MALT, which is mucosa-associated lymphatic tissue. So again, lymphatic tissue and the lymphatic organs is composed of connective tissue that has a really high concentration of lymphocytes. Lymphatic organs include lymph nodes, spleens, the thymus. The thymus is an endocrine organ, and we'll talk about that more later. Your tonsils, you've probably dealt with your tonsils at some point in your life. Along with this, I'm sure you've heard the term adenoids. A lot of people have their tonsils and adenoids removed as a child because they will have been so inflamed due to chronic antigenic stimulation that they cause a lot of swelling and pain. So in the gastrointestinal tract and in the urinary tract in particular, you'll have diffuse tissue that's spread out, and again, that's mucosa-associated lymphatic tissue. The appendix, the vermiform appendix, is a little finger-like shaped projection off your cecum in your GI tract. And I'm sure you've known people that's had their appendix out. Maybe it happened to you. They often get inflamed and impacted and can become a surgical emergency. They used to think that the appendix really had no job, and that it was simply a vestigial organ that was left over from days when we had a little bit more of a rudimentary diet. But at some point, they finally looked at this in cross-section and discovered that you had a really rich infiltration of lymphocytes there. So they're thinking that perhaps the appendix does contribute to our immunity. You'll find a high concentration of lymphatic tissue and lymph nodes around regions that are going to be more susceptible to entry of pathogenic material. Think about where you would be infected from: your mouth, your nose, and so therefore you're going to have a concentration around your neck. Also, vaginal regions, urethra, rectum, so you're going to have a lot of lymph nodes and lymphatic tissue around the groin region. So you need to understand that when lymphatic tissue is exposed to a pathogen, it has a reaction that's going to cause it to be swollen and painful. This reaction happens because it has called in the cavalry. It's going to have a massive influx of cells of inflammation that are there to try to clean up the infection. Okay, I just added a blank slide and put this picture on there showing a capillary bed because I wanted to back up and just remind you about the blood flow dynamics we've talked about in previous chapters. Remember that your heart is producing blood pressure that is pushing fluid, pushing blood through your blood vessels, and that is your hydrostatic pressure, as is pushing fluid, plasma, into the interstitium, is concentrating the plasma proteins in the blood cells. Eventually, as it goes to the venous side of that capillary bed, the blood colloid osmotic pressure is going to build up and it's going to start to draw fluid back into the venous side. Well, the trick is that is not a perfect system, and it's not going to pick up but about, say 80% of the fluid that is driven out by the hydrostatic pressure produced by the heart. So what that leaves is fluid in the interstitial space. If it stays there abnormally, it's referred to as edema. But what happens, you have lymphatic vessels, which are these very thin-walled, blind-ended tubes that kind of parallel your capillaries, parallel blood vessels, and they will actually pick up that extra fluid. And it will eventually dump that extra fluid back into the venous side in the subclavian veins. So, in essence, your lymphatic vessels are acting as a scavenger system for the fluid that's not driven back into your capillary system by the blood colloid osmotic pressure. Let's take a closer look at some of the lymphatic organs that we mentioned earlier. So remember I said that your lymph nodes are the little bean-shaped organs. You have them concentrated in areas that are going to be more critical as far as exposure. So think about the fact that when you want to feel of something, when you want to pick something up, you're using your hands, and so therefore you're going to have them concentrated around your armpits. You're going to have them in the area of your groin. So one of the other places that's filtered by these axillary lymph nodes would be the breast tissue. So when women breastfeed, that certainly leaves a way that pathogens can enter the mother's tissues from the baby's mouth. Breastfeeding is actually a fairly traumatic and injurious event when a woman first starts nursing. It's not unusual for the nipples to be cracked and bleeding. So what will happen is the lymphatic fluid from the breast tissue will be drained through the armpits, the lymph nodes in the armpits, I should say. And that's one of the reasons that when they're looking at breast cancer, one of the places, well, really the first place they'll look for the cancer to spread would be to the axillary lymph nodes. When you look at the lymph nodes, they talk about the lymphatic vessels being efferent and afferent. So what happens is you've got afferent capillaries. I realize I've cut off a lot of the text. That's bringing lymphatic fluid into the lymph node. So these aren't capillaries as in blood capillaries. We're talking lymphatic capillaries now. And so this lymphatic fluid is getting an intense exposure to all the lymphocytes that are clustered in this lymph node. And then it leaves through the efferent lymphatic vessels. Here's a word you should know. It's lymphadenopathy. Lymph for the lymphatic system, adeno for gland, pathy for disease. So it's disease of lymphatic glands. And what it is referring to chronically enlarged lymph nodes. These are lymph nodes that are massively enlarged or they've been enlarged for an excessive period of time, i.e. months. So this can be a chronic infection that's happening. And quite often it can actually be a sign of cancer. So there have been many people that will be diagnosed with things like non-Hodgkin's lymphoma and that sort of thing because they've got these chronically enlarged lymph nodes around their neck region. And these enlarged lymph glands tell the physicians that they need to investigate further. A lot of times they will actually stick a needle in them, aspirate them, look at the results on a slide, and decide where to go from there. I had a friend whose wife had an enlarged lymph node in her armpit, axillary region, and she went for her physical to the OBGYN and mentioned it, and he sent her home on some antibiotics for about 6 weeks. And I questioned that when I heard it. I said, we didn't aspirate, we didn't do anything beyond that. And they said, no. I suggested they go back for another opinion, and they did. And she ended up having stage 2 breast cancer. So these are things to pay attention to. As I mentioned earlier, by definition, lymphatic organs or lymphoid organs have this connective tissue capsule around it. And they include the spleen, the lymph nodes, and the thymus. Location-wise, you're looking at the spleen right there. The thymus is up in the mediastinum. And then again, the lymph nodes are going to be spread throughout the body. The spleen is a highly vascular organ. That's one of the reasons that it gets removed a lot when it's suffered trauma. You've got people hemorrhaging from the spleen. You can live without a spleen, but you are more susceptible to infections that way. Remember, the spleen is going to be the organ that's going to filter out old and damaged blood cells, red blood cells. So it happens that the spleen contains what they refer to as red pulp and white pulp. And this red pulp is a concentration of red blood cells, and the white pulp is a concentration of more lymphatic tissue. You have sinusoidal capillaries, which means that you've got capillaries. These are blood capillaries I'm talking about now. The cells have gaps between them. If you recall that from earlier discussions about the capillaries in the cardiovascular system. These gaps between these cells are so large that they have macrophages standing guard there to keep anything critical from getting into the bloodstream. So you can think of the spleen as acting as a very large filter for both the blood and the lymphatic system. The thymus is in the mediastinum. If you remember the mediastinal cavity, which is the one that goes between the two pleural cavities. The thymus is pretty unique. It is an endocrine organ, meaning that it does not require a duct to secrete the products. It atrophies or withers away after puberty. By the time you hit old age, your thymus is basically scar tissue and fat tissue. It produces a hormone known as thymosin, and we're going to be talking about B cells and T cells and NK cells very shortly. And it just so happens that thymosin is what stimulates lymphocytes to develop into T cells, T for thymus. So all white blood cells and all red blood cells are all formed in the bone marrow after you're born. And the cells that are referred to as T cells or lymphatic cells that are T cells, they actually migrate from the bone marrow to the thymus, and they're their influence under the hormone thymosin. And we'll discuss these a whole lot more later. So one of the reasons that older populations of people are more susceptible to cancers and chronic infections and viral infections is because the thymus has atrophied, and so they no longer have ways to activate these clones of sophisticated T cell protectorants. So thought I'd throw a few pictures in here of tonsils. These are obviously tonsils that are not having a good day. Tonsils are something that you may or may not have had removed as a child. They're not removing them as often now as what they used to. At one time, it was quite routine. Quite often, kids would, have a sore throat a couple of, times, and they said, "Hey, let's get the tonsils out." now they realize the tonsils are fairly important immune organs, and they've actually shown a slight increase in the number of throat cancers in people who've had their tonsils removed at a young age. That's not to say I'd panic if I'd had it done, but anyway, tonsils are normally sort of out of sight, out of mind, hidden in crypts over behind, here's your uvula, and this is your pallido-glossal arch, and this is a big swollen tonsil. So tonsils are there. They normally have these little pits, these little crypts on them that will trap particles of food. And again, the whole idea behind a tonsil is to stimulate your immune reaction to whatever's in your food in case there's a problem there. But sometimes they overreact. And when they get this swollen, they're going to actually cause problems with breathing. And this person is probably a pretty good candidate for a tonsillectomy. So typically, if you've had your tonsils removed, that's what those are, they will also remove that piece of lymphatic tissue that's sort of hanging down over behind those, referred to as the adenoids. So again, going down the list of what we'd mentioned earlier in the chapter, we've talked about lymphatic organs. Let's mention lymphatic vessels, get a little bit more detail here. As I mentioned earlier, they are blind-ended tubes. In other words, if you've got an artery coming down or arterial side going into the capillary bed, turning into the venous side, you have a loop. But when you have a lymphatic vessel, it's simply a tube. It's just a one-way tube. Again, they refer to the term as being blind-ended. It's not a loop at all. It's just a one-way tube. So they do parallel arteries and veins, and as I mentioned earlier, one of the important things we're doing is actually reabsorbing the fluid that's not pulled back into the venous system by the blood-filled or osmotic pressure. And at the same time, what they're also doing is they're going to be taking that fluid and filtering it through a lymph node before it goes back to the venous system to make sure there's no pathogens there. These are very, very thin tissue capillaries composed of endothelium, very similar to the capillaries that you saw in the cardiovascular system. One thing to note is they do have valves, just like veins, except they have a whole lot more of them. The lymphatic vessels will actually have valves just every few millimeters. So they're going to be scavenging again, as I said earlier, that excess fluid out of the interstitium. And if by chance any plasma proteins manage to escape, so you'll see that happening in a bruise, some sort of injury, those will be picked up by the lymphatic vessels also. So here's a diagram showing a capillary bed, and the green are diagramming your one-way lymphatic vessels. Here's a definition for you, although these pictures are fairly extreme. Lymphedema. Edema, by definition, is excess fluid trapped in the interstitial space. Remember, the interstitium is the fluid that's bathing all your cells. The biggest difference, if you recall, between plasma in the blood vessels and in the interstitium is that plasma has plasma proteins, whereas interstitial fluid should ideally have none. But if fluid is trapped in the interstitium, it's referred to as edema, and if it's trapped because of blockages of lymphatic vessels, then it's referred to as lymphedema. You may have seen a person, usually women, that have had mastectomy from breast cancer, and they'll also go in there and remove what they refer to as sentinel lymph nodes from the axillary or armpit region. And when that happens, that's again severing lymphatic vessels. Now that they have blockages, and a lot of those women will have permanently enlarged arms from the edema that's now trapped inside there. So these two examples are from countries that have problems with elephantiasis. I have a picture and explanation on the next slide. You can see again this massive amount of swelling. One of the things that can happen here because of all the venous congestion, you can see right there, you'll actually get fluid that starts to weep out of the tissues. So you can see this person has actually been marked for surgery. They're going to be amputating all the severely enlarged hand. And I get the question a lot, well, why can't you drain it? Well, imagine sticking a large needle into a wet sponge. You're not going to get anything out. And all this excessive fluid is trapped in the interstitium, very much like water is trapped in a wet sponge, and there's no way to drain it. You can elevate it, you can massage it, all of those things will help, but once you've got edema to this degree, it's not going to be able to be reduced any dramatic degree without surgery. I had to return to this slide because I lied to you. I had removed a slide that had a definition of elephantiasis. If you want to look that word up, I'll spell it for you, elephantiasis. And it's caused by a microfilaria. That's a tiny hair-like worm that gets into the bloodstream. That should be an E. Don't get too bogged down in trying to learn the anatomy of the lymphatic system. A lot of the textbooks will vary a little bit in description, which makes it really frustrating trying to figure out exactly how to teach it. You can see a big difference in the amount of body surface area that's drained by the right lymphatic duct versus what's known as the left thoracic duct or the thoracic duct. So the right lymphatic duct only drains what you see here in purple, and the rest is drained through the left or the thoracic duct. If you ever hear of the term cisterna chyli, what that means is a well that contains lymphatic fluid, and is simply an enlargement at the base of the thoracic duct. So the right and left lymphatic ducts are returning fluid, the lymphatic fluid, into the subclavian veins. I mentioned that earlier. That's the fluid that they scavenged out of the body that did not go back into the veins earlier. It's now going, it's been filtered, and it's going to be returned into the subclavian veins. We'll mention these later in the digestive system, but when we're talking about the lymphatic system, we have to mention these. A lacteal is a lymphatic capillary that's found in the small intestine. Remember back in the early chapters, I told you that a cell that has the job of absorbing something will have microvilli on the surface. And it just so happens that the small intestine is lined with these cells, and these cells are going to be picking up the dissolved nutrients such as amino acids, glucose, etc., that's been digested from the food that you ate. Well, it just so happens that lipids are going to be too large to be absorbed, and so you'll have what's known as a lacteal right through the middle of these villi that are open enough to absorb these molecules of lipids. So a lacteal is the gap, is the opening in the center of a villus. So let's now move into talking about lymphocytes. So as I talked about in the blood chapter, they're the second most populous white blood cell, second to neutrophils. And as I've also mentioned several times, most of your lymphocytes are actually in your tissues, not in your bloodstream. There are three types that we'll be discussing: T cells, B cells, and natural killer cells. I also mentioned earlier, I told you that T cells, they're formed in the bone marrow, and they mature in the thymus. These are actually the majority of the lymphocytes that are in your bloodstream, and they fight pathogens that live inside your cells. So think of viruses, pathogens such as that, certain types of protozoa, hemabartonellosis, etc. So they also are going to be fighting cancer cells. And there are several types of T cells we'll be talking about. We'll talk about helper T cells, we'll talk about inducer T cells, etc. But these T cells kill infected cells, and they're termed cytotoxic T cells, cytotoxic cell killer. and they do so what they refer to as a kiss of death. So if this is your lymphocyte and this is your infected cell, what will happen is the lymphocyte will actually touch it, drill holes into it, and put enzymes in there that will cause the cell to rupture. So when we talk about the kiss of death shortly, that's what we're talking about. It's very important to understand this whole type of immunity is referred to as cell-mediated immunity. So when you hear the phrase cell-mediated immunity, you should think T cells. So this is something that some researchers won the Nobel Prize for around the mid-'80s. So B cells also develop in the bone marrow. However, they don't launch. They stay in the bone marrow and they mature there. Once they are activated by being introduced to a pathogen, they're going to develop into a plasma cell. And plasma cells secrete immunoglobulins, also known as antibodies. This type of immunity is known as humoral immunity. And the term humoral comes from the words humor, as in humor is vapor, is the Latin, is Latin for liquid. So these antibodies are secreted by plasma cells, and when you have a bacteria or something that needs to be killed, then these antibodies will simply clump or agglutinate on the cell, and then that cell will be taken out of circulation by the spleen or by lymph nodes or by the liver. So again, I've already drawn you a diagram of the cytotoxic T cells. These are the ones that we often think of when we think about T cells. And again, typically they're looking for things that live inside cells, like viral infected cells, certain types of cancers. One thing they do that's not good is they will actually attack tissues that have been transplanted, such as, again, kidney, heart, etc. And so that's one of the reasons that the person will have to reduce immune system reactivity by staying on anti-rejection drugs, and that will make that person very susceptible to infections. And people who are on those type of drugs are really prone to infections by viruses and cancers. So a huge class of T cells are known as helper T cells. These help both T and B cells, and they produce things like interferons and interleukins that we'll talk about a little bit later on. Those are actually chemicals and proteins that will help complement, help aid the immune system. So after a reaction has been going on for a while and the infection is getting under control, something has to turn these cells off. Otherwise, they'll just keep amplifying their reactions. So the suppressor T cells, they actually are produced after these previous two, and these will help say, okay, I'm getting better now. You can stop all this immune system activity. There are many other types of T cells. They're being discovered all the time, and we'll discuss those later. Along with the other types of T cells, a very important clone is referred to as memory T cells. You're going to see memory T cells and B cells. These are going to be the cells that will be reignited, if you will, when you are infected a second time. So after exposure of the original naive T cells to the antigen, you're going to have production of the cytotoxic T cells. At the same time, you're going to have production of the memory T cells. This means that the second time you are infected with the same virus or whatever the offending agent is, your immune system will already be primed and can respond much quicker, and you might not even realize that you've been infected at all. Or if you do get sick, you won't feel as sick. You can think of a cytokine as a type of hormone, and it allows cells to talk to other cells. So they basically allow cell communication. And you'll see individual types of cytokines. Sometimes you'll see them referred to specifically as a lymphokine. But anytime you see anything with this suffix, you're basically talking about a type of protein that is going to assist in cell communication. So one of the things, very important jobs these cytokines will do is to help turn on the B cells after the T cell system has been activated. So they're going to draw cells such as macrophages and natural killer cells to come to the region through chemotaxis. If you recall the word chemotaxis, it means that it's releasing a chemical that will attract other types of cells. It's equivalent to calling in the backup or calling in the cavalry. So these helper T cells are producing cytokines that are going to amplify the effect of the immune reaction and draw more and more cells to help fight the infection. So as I mentioned earlier, the suppressor T cells will be produced after the cytotoxic T cells and the other clones. So these are going to help turn off the immune reaction after it's done its job. So in other words, when you've got the infection, the original infection, you're going to have a production of your cytotoxic T cells. You're going to have production of your helper T cells. If I had a more cooperative stylus, I'd be in great shape here. You're going to have production of your memory T cells. And then finally, you're going to have production of your suppressor T cells. And again, those are the ones that will tell the body, okay, we've got the infection under control, and you can stop the inflammation, because inflammation, truthfully, is what will actually kill the vast majority of us. They've linked inflammation in our bodies to everything from heart disease, arterial disease, cancers, etc. So inflammation is good in that it helps clean up an infection so an injury can heal or an illness can heal, but it has to be suppressed, it has to be turned off, and too much inflammation is definitely not a good thing. So how does your body recognize a cell that belongs to it versus a cell that's a foreign cell, that's an invader or a transplanted cell? And that's because of proteins in the cell membranes referred to as MHCs, or major histocompatibility complex. So if you break this word down, it looks like a long one, but it's really not. Histo refers to tissue. And so your body wants tissue that's going to be compatible to its own tissue. So if you recall, back when we talked about the cell membrane, we talked about the fact that it's made of the bilayer phospholipid membrane. So you've got this double layer membrane. And then also you've got these cell proteins that are embedded in this membrane. And they have multiple jobs, but one of these jobs is to help the body recognize what cells belong to it. And these are referred to as a major histocompatibility complex. So there's two types. One lets your body say, this is mine, and the other lets your body say, okay, this is a pancreatic cell, or this is a liver cell. So when your body meets a cell, or an infected cell, or a cancerous cell, these proteins will be altered that are in the cell membrane, and then your body will recognize, this doesn't belong to me, and therefore I'm going to attack it. A very important phase of an immune reaction is going to be antigen processing. So antigen presentation and processing occurs before the T cells and B cells get involved. And as a matter of fact, some B cells can also function as an APC, or antigen presenting cell. So these cells have the job of stripping away the antigen from the bacteria or infected cell and basically showing it to the immune system, in this case a helper T cell. And that helper T cell will then be activated and will go on to stimulate the B cell system and production of the cytotoxic and memory T cells. So on this diagram, if you'll look, the entire little green organism there is shown as having the little red spot, which is the antigen. So the antigen, the little red area, is going to be the protein that lets your body actually recognize that particular offending agent. On this slide, I mentioned all these different types of cells, but really the big thing to pay attention to is they're all phagocytic cells. These are in the brain, these are in the liver, and then these two are simply phagocytes that are in the skin. And again, they're going to be assisting the immune system by stripping off the antigen and going under the process of antigen presentation. And another thing to point out is the way this works with a viral infected cells, which of course viral infected cells are the ones that your T cells will fight the most. So if you recall, inside your cell you have your nucleus, and inside the nucleus you'll have the DNA. The DNA contains a blueprint for all your body's proteins. Well, a virus will infect a cell and insinuate itself into the DNA. So now you've got abnormal DNA, and that's going to affect the types of proteins that are made. So now this will be reflected in the abnormal MHCs that are on the cell membrane. So therefore, the antigen presenting cells are able to recognize these as not being normal. So therefore, it knows it's an infected cell and will have to be disposed of. And the immune system will be stimulated to fight that particular antigen. I was never able to find one particular chart that said everything I wanted to say. And so in my original PowerPoint, I ended up with probably about a dozen because I had bits and pieces of individual ones that I liked. But I've tried to narrow this down so you don't have 100 PowerPoint slides here. Death by PowerPoint's never fun. And this is kind of a good summary here. So say here is your antigen. So be it, viral infected cell, bacteria, whatever. The antigen is being processed by the antigen presenting cell. So again, this is going to be your B cell or your macrophage. So that's your APC. So it's presenting the antigen to the helper T cell, and that's going to be turning on all these other cells. Again, so you've got your helper T cell, that's going to be activating the B cells, which will produce the immunoglobulins, which are the antibodies over here. You've got the helper T cells that are going to be creating chemotaxis and attracting other macrophages to the area. Then you've also got your activation of the cytotoxic or killer T cells. So what's not on here, of course, is going to be your memory T cells or your suppressor T cells that happen later. So it's just a little bit incomplete. So I've mentioned B cells before. B cells, again, just like T cells, they start their life in the bone marrow. That's where they're made along with all the other blood cells. But instead of going to the thymus and having their maturity stimulated by thymosin, they actually stay in the bone marrow and mature there. Once they enter the bloodstream, they circulate as B cell lymphocytes. But when they've been presented an antigen or they've been activated, they turn into a plasma cell. And it's a plasma cell that will secrete antibodies. So, unlike the T cells, which the infected cell had to actually meet and contact a T cell, a cytotoxic T cell, to be destroyed, what's going to happen here is the infected cell will actually come into contact with the antibodies, and it will actually end up being clumped up and filtered out by the liver or kidneys. I just find this rather remarkable here. Each B cell, each individual B cell lymphocyte can create millions of molecules per second. So it's just, they can really flood the humoral system or the blood and lymphatic system with these B cell lymphocytes. And again, what happens is these antibodies will clump up on the offending cell, usually in this case a bacteria, and will cause these things to precipitate, which means clump up, and be basically filtered then out of the lymphatics and out of the blood system. A few things to make sure you remember. The B cell system is referred to as humoral immunity. and this is talking about antibodies. Let's see here. Antigen processing, again, can actually happen in B cells, although a lot of times it happens in macrophages. It can happen in both. And these B cells are activated by helper T cells. So make sure you understand as you do your reading that your B cell lymphocyte, once it's activated, will turn into a plasma cell. So having it be presented with an antigen basically turns it into a plasma cell, and it's these plasma cells themselves that will be secreting the antibodies into the plasma and the interstitial fluid. And just like in T cells, you also have memory B cells. A little interesting factoid, although it doesn't seem intuitive, when you're vaccinated against a virus such as a flu virus, of course, I told you earlier that T cells normally fight viruses, whereas B cells often fight bacterial infections. With a vaccine, what happens is that your memory B cells actually do most of the heavy lifting. So you would think it would be the T cells because of the viral particles that's being used in the vaccine. But just oddly enough, and I really don't have a good explanation why, if anybody has one, is a vaccination is going to, the secondary, the reaction that happens later to help you fight an infection will be guided by memory B cells. So let's talk about antibodies. These are also known as immunoglobulins. So I'm not really concerned that you know the chemistry of it. They always talk about constant portions and variable portions. But I'm more concerned that you know particular situations in which types you'll see that will be produced in certain situations, and that's what we're going into this next few slides. So what I want you to know is that IgM is going to be the antibody that's produced when you're first exposed to an antigen. So you're going to have production of, for example, let's do a little time graph here if my stylus will cooperate. So if here is the point at which you are exposed, you're going to have production of IgM that's going to come up, and then it's going to start to go down fairly quickly. The second antibody that's going to be produced is the IgG, and it's actually the more critical one. It's going to be produced a little bit later, and it's the one that's going to stay in your system a little bit longer. IgD, we don't really know a whole lot about it. We know that it's active in helping activate B cell lymphocytes. It has to do with a protein in cell membranes. And then I do want you to know that IgE is going to be the one that's active in allergic situations. If you're having a hay fever reaction or allergy to your cat, something like that, that's going to be your IgE that's involved. And then IgA is a little bit different. It is actually produced and released onto the surfaces of mucous membranes. So if you've ever had an intranasal vaccine, that's actually what they're trying to stimulate, which makes sense when you think about the fact that your mucous membranes are where you're exposed to things like the flu virus and everything first. Your eyes, your nose, your mouth, etc. So again, it would be logical to use a vaccine that stimulates the secretory antibody IgA being released on the surface of the mucous membranes again. So one thing, and again, this is not something for testing purposes, but usually when they give you an intranasal vaccine, they're able to give you a modified live, whereas when you're giving a subcutaneous vaccine or an intramuscular vaccine, it's going to be a killed vaccine. You can't use a modified live or what they call an attenuated vaccine in someone who's debilitated, very young, very elderly, or pregnant, simply because there's always a slight chance it might revert to what they refer to as a wild type. One thing I want to add while we're talking about this, you don't have to know the term. The term for a memory response is anamnestic. So going back to our little time chart right here, we had this as being your first exposure. let's extend the time down here. Let's say you have a second exposure right here. Well, and this could be, for example, let's say you're taking your child in for the second immunization against polio or rubella, something like that. And what you're going to see is now, let me change color so you can see what I'm doing. I'm going to overwrite this with a yellow. So now this IgG, when it comes up, it's going to come even higher, and it's not going to go as low as what it did. So this is why you give vaccines in series of 2 or more. I know when I went to South Africa, I had to have a series of hepatitis A vaccines. And again, they give you these multiple injections, so you get this first response, and the second vaccination will give you an even better response. And again, it doesn't go back to the original level. No vaccine is perfect, and if you get a vaccination on a day that you're not feeling well, perhaps your immune system is a little bit down, you might not even mount a good immune reaction to that vaccine, and therefore you don't develop a decent immunity to whatever it was you were vaccinated against. So again, there's no perfect vaccine, and no vaccine will protect you 100%. A vaccine might keep you from getting sick, or it might simply keep you from getting as sick. So here's a summary of some of the things we had talked about on the previous slide, talking about IgA. You're going to find it any place you have mucous membranes, things like your respiratory tract, your nasal mucosa, oral mucosa. It's going to be in your saliva, it's going to be in your tears. You'll find it in vaginal secretions, etc. So IgG, again, is the main one that's going to help your immune system have a bit longer lasting protection. And IgM is the first one that's produced. It's important, but it doesn't do the heavy lifting that the IgG does. I can't say that three times quickly. And again, just as a reminder, it's IgE that will actually make your life miserable sometimes, because it's going to be present when you're having an immune reaction. And this includes the potentially deadly reactions that you can have that will lead to an anaphylactic reaction, anaphylactic shock. So let's switch gears here and talk about the third and last type of lymphocytes. These are referred to as natural killer cells. And these are different than T and B cells because they do not have to be exposed to the antigen previously. So in other words, as we talked about earlier, a T cell or a B cell has to be activated. These natural killer cells are sort of lurking through your tissues, looking for something with the wrong MHC, looking for something that doesn't belong there. So these are credited quite often with detecting and finding and killing early cancer cells. So let's talk about, as we get ready to close up this chapter, types of immunity. And you've seen these terms before when you talked about reflexes. Innate immunity means it's something that you're born with, and acquired means it's basically an immunity that you develop after birth. You can also divide these up into active immunity and passive immunity. And what this means is that active immunity means that your immune system mounted a reaction. Passive immunity means that you got it somewhere else. And I'll give you some examples as we go through here. So a natural active immunity would be, let's say your friend sneezed on you. So she exposed you to a nice Escherichia virus or rhinovirus or whatever, and she infected you, and so your immune system had a natural exposure and mounted its own immune response. An induced active immunity would mean that you were vaccinated against it. So let's say you got a flu vaccine again, for example. So that has been induced. It's not a natural infection. Okay, going down to the definition of a passive infection, that means someone else's immune system made those antibodies. And the natural version of that will be the maternal antibodies that you get through the uterus when you're a fetus, or that you get through colostrum from mom's first milk when you're a nursing infant. And then there is an induced passive immunity If you've ever heard of giving somebody an antitoxin for a tetanus infection, something along those lines, then that is using antibodies that were made in somebody else's body. Used to, the old tetanus antiserum was actually made from horses, and as you can imagine, the patient's immune system would often react to the equine version, and it would cause joint reactions, severe arthritis, become very crippling, if not fatal, and they would refer to that as an arthritis reaction. Fortunately, we do now have better sources. So some very important differences here. Your vaccines, again, this is your active induced immunity. They're not going to go to work right away. They're going to take a while. And as I mentioned earlier, you have several types. These are the most common types. Mostly you get a killed or inactivated vaccine. When people say, oh, I hate getting the flu shot because it always gives me the flu. No, it doesn't. Vaccine has a chemical component known as an adjuvant, which aids your immune, sort of stimulates your immune system to kick in. And sometimes it will make you feel badly. Sometimes it will give you a sore arm. I know when I had my tetanus shot many years ago, I swore my arm was sore for 2 weeks, but that's because your immune system is doing what it should be doing. The other opposite side of that is your passive induced immunity. Like I was talking about, this is going to be things like your antitoxin for tetanus, and that goes to work immediately, but it's not going to stay in the system very long. The reason that you would use something like your antiserum or your antitoxin is a lot of times things like tetanus will kill you before your own immune system has a chance to go to work. So what would happen in some situations, they would actually give you the antiserum dose first and then give you a vaccine later, under the assumption you're going to live long enough for the active to work. So let's think about what happens when your immune system is not functioning like it should. So think of your immune system as having a normal range. And in here you've got your normal healthy reactions to your natural infections, your reactions to your vaccines that you should have. If your immune system is reacting a little bit too much, then that would be classified as an allergy. If it's reacting way too much, if it's reacting to your own body, then that is referred to as autoimmune. And again, forgive my bad stylus here, but you get the idea, I think. So you've got your normal, you've got your overreaction, which is in the allergy category, and then you've actually got autoimmune disease. If it's not functioning well enough, then you've got your immunodeficiencies. You've got your compromised immune system. This can be to something to the degree that you get sick very easily. It can be to the range that it actually kills you. People with advanced cases of HIV/AIDS, people undergoing chemotherapy, people born with a rare condition of combined immunodeficiency where they're born without the cells of the immune system at all, they will actually usually succumb to infections. And Pneumocystis carinii bacteria, for example, is a common pneumonia that kills people with severe immunosuppression. So with autoimmune disease, your body is attacking itself. Your immune system is attacking its own body. So I put a couple of examples here, more common ones we think about. You've got your rheumatoid arthritis, in which the immune system is attacking the lining of the joints. You'll see this more often, although not exclusive to middle-aged or older women, and quite often in the hands. You see the severely affected knuckles here. Then you've also got things like lupus erythematosus, which is a multi-system disease, autoimmune disease, and you'll see that ranging in from very young people to older people. There are many different types of immune diseases. There are many things that are blamed on autoimmune disease. the things that we suspect are caused by immune reactions, things like alopecia areata, in which the person loses all the hair, either for a short period of time or for the rest of their life, including brows, head hair, etc. There are types of kidney diseases, there are types of eye diseases, all sorts of things that are considered to be autoimmune diseases. The most common type of immunodeficiency that we see, again, HIV/AIDS. This over here is actually a child with CID, combined immunodeficiency disease. Thanks to genetic engineering and gene therapy, this has really come a long way. There have been cases of siblings that were treated successfully for this. So these next two slides, again, these are obviously HIV/AIDS. These are actually Kaposi cell tumors, and that's a viral-caused cancer that normally a person's immune system can prevent these from happening, but when the T cell population has been devastated by the AIDS virus, then these tumors can actually come up. And then again, over here you simply just see the extreme wasting that you'll see. I mentioned earlier allergic reactions. These are just when the immune system is a little bit too hyper. And you've got several different categories, and this is your old type system, and now they're actually categorizing them in a little bit newer fashion here. One thing I always ask is anaphylactic reactions. I want you to know that those are considered to be type 1. Those are immediate hypersensitivity. I'm sure you've probably known of or heard of your kids being exposed to peanut allergens, that sort of thing, and they have an immediate, sometimes life-threatening reaction to it. Your delayed type reactions, these are your type 4 reactions. Type 3, this is going to be related to your immune complex reaction, so you could do a circle there. And what happens, you've got precipitation of the antibodies and the antigen, and it can clog up the blood vessels of the eye, it can clog up the tubules of the kidney, etc. Then your type 2 reactions, you're looking at more over here, and again, type 4, this would be your delayed type. Just kind of want to give you an example of what it looks like. And I've got a slide showing you what a granuloma looks like coming up. Basically, granuloma is if your body has something inside it can't get rid of. Let's say you've got a fungal spore in the lung or something and it can't get rid of it. The body will actually wall it off. So here's what granulomas will look like. That's a granuloma. You could have a splinter in this finger or something that stayed there for a long time. And this is actually an entire spleen that's had a severe granulomatous reaction. And again, that just falls under the category of your immune system having a little bit of a overreaction. And just to mention anaphylaxis again, I mentioned it earlier when I talked about IgE, and also when I talked about your type 1 allergic reactions. So this is your immediate hypersensitivity taken to an extreme. Many people actually will die from these type of reactions. This is why people carry things like EpiPen. It might be to things like penicillin. It might be, I know I'm allergic to erythromycin. It might be a bee sting, again, peanut allergies. But it causes things like swelling of the airways, and it can be fatal if not treated successfully. You've reached the end of the chapter, and please make sure you do your reading assignments, because basically I just touched on the topics that I really want to emphasize, and so I do leave it to you to do some more reading and do some more digging if you don't understand the concepts, and I will see you next time.